going to go through each of the remaining vaccines that are in the pediatric schedule. The first one's hepatitis B, and then usually the next one is DTP. And DTP is diphtheria, tetanus, and pertussis. I'm going to start with diphtheria because nobody even knows what diphtheria is anymore. It's not really a disease, it's around. And it's caused by a bacteria. And if you get the infection, the bacteria can release a toxin, and the toxin can cause some inflammation of the heart. And if it's really severe, it can cause some paralysis of the soft palate, which makes it difficult to swallow. Okay? Death can be up to 10% without medical care, and that's really the optimal thing here when it talks about without medical care, because where are pockets of diphtheria remaining in the world are places like, the most recent outbreak of diphtheria was about 900 and some people, was when the USSR broke apart, and so it was in Russia in a population of chronic alcoholics, homeless people, okay, because they didn't have any medical care. And so that was the last outbreak, and that was maybe 7 or 8 years ago. Okay. So there are several different strains of this particular type of bacteria, and most of the strains do not release the toxin. Now this is really key. When I investigated this, I found this really interesting. Only when that very specific type of bacteria that has the capability to release the toxin is infected by a virus, then is that bacteria going to be able to release the toxin. So you have to have a specific bacteria that gets infected by a virus that makes it be able to release the toxin. Now out there in like the world, you know, you're trying to get a bacteria and a virus to get together here in order to make the bacteria deadly. I mean, I just found that pretty amazing when I started reading that, because I mean, I didn't know much about diphtheria. You don't see cases of it anymore. And so I never really spent much time reading about it until I started reading the background of the disease base for the vaccine. So what's the incidence? Well, it's gone down. Like I said, you hardly ever see it anymore. In that 20 years, there were about 3 cases per year in the United States. And how do you treat it? Well, it's treated with erythromycin or with penicillin, which is another reason why you don't see it very much, because, gosh, maybe if you did get exposed to diphtheria, if you go in with a sore throat, what's the first thing the doctor does? Gives you an antibiotic, okay? The wide use of the vaccine began around 1948, and that was about the same time that we started widespread use of antibiotics for everything. And since most sore throats today are treated with antibiotics, and diphtheria is sensitive to most of the prescribed antibiotics, then is the real reason for the disappearance of the disease from the vaccine? Or is the real reason for the disappearance of the vaccine because we use antibiotics for everything? Maybe we don't even need that vaccine. You know, do children, and if we do they need 5 doses? Do they need a dose at 2, 4, 6 months a year and before they start school for something that you see 3 cases a year and gets treated with antibiotics? I'm not even sure why we do that. Really, that information is just astonishing to me, because the death rate from diphtheria was down here when the vaccine was started. So it's just like a lot of the other things. I mean, and these numbers, this is a really pretty good website, this healthsentinel.com. I mean, if you really want that graph, that's where you get that from. And they are compiled from the government health statistics. So these aren't just somebody's, you know, guesstimate. All of these graphs come from government, the statistical data that the government collects every year on all of the infectious diseases. So let me see, there's 2 different types of diphtheria vaccines that we use. One is DT with a little d, and that is that it's usually in kids over the age of 7, and that there's equal amounts of diphtheria toxin and tetanus toxin in that vaccine. The other vaccine is a capital D, capital T. These are what we use for little kids, and this is just amazing to me, because it is 8 times more stronger, 8 times more potent than the one that we give to adults. So I'm not exactly sure why that is, and I haven't really found any information to understand why that is, other than the fact it's just we've been doing it since 1948, and so it's one of those things that just get propagated along. We use one that's much stronger for something that is treated with antibiotics that maybe we don't even need anyways. And the other important thing is neither one of these are mercury-free. There are no mercury-free tetanus shots, none. Now, what about tetanus? Because this is always the one that always comes up a lot. You know, when parents start asking about what do you do for certain things, I mean, they can kind of get that polio is pretty much eradicated, and they kind of understand that, you know, I don't think my kid needs hepatitis B, at least not as a baby. And maybe this diphtheria thing, why do we even need this? But the 3 that come up that we're going to spend a little additional time on is tetanus, pertussis, and H. flu meningitis, for which the Hib, okay? So what about tetanus? Well, tetanus is an infection that's also caused by a bacteria. It's an anaerobic bacteria. It means it's a type of bacteria that grows in places where there's no oxygen. It's also found in animal feces, particularly horse and sheep and cattle and dogs. And the reason for that is that most of those animals that are listed up there are ruminants. You know, the tetanus grows in soil. So when they're, eating, ruminating a lot of grass and things like that, and chicken that are pecking at the ground and stuff like that, that gets into their intestinal tract and passes out through the feces. So that's why that sort of gets perpetuated that way, because the tetanus lives in soil. Under anaerobic conditions, if you get like a deep puncture wound to the foot, that's always the thing that people talk about the most in terms of nails, stepping on a nail or something like that. If that nail happened to be contaminated with the Clostridium tetani and gets pushed up deep inside of your foot, in those conditions where there's not a lot of oxygen, that spore of that bacteria then can evolve into the bacteria, and then the bacteria can release the toxin, and it's the toxin that causes the infection. There are several different types of tetanus infection. The most common is the neonatal, and it's seen in third world countries because they use unsterile instruments to cut the umbilical cord. So the reason why we started using tetanus vaccine in 2, 4, and 6-month-old babies is because in third world countries they see neonatal tetanus from not using sterile instruments. So we do that here. And also the tetanus vaccine has been around since the 40s, and I do believe that probably in the 40s in the deep south, like here in the United States, they probably did use unsterile equipment, and they used to use shoestrings and things like that to tie the umbilical cord. So there may have been more incidences of that early on, back in the 40s when this first started being used, but certainly not now, certainly not today. There's a cephalic type of tetanus that's that's the lockjaw one. Localized is sort of, you can have just a thing that's just located on an extremity. Generalized is the most common, where you have the jerking sort of spasms that can happen all over the body. In fact, 80% of the time, if you get tetanus at all, it's a generalized sort of spasm. It's spasming in your muscles is what tetanus is. It's spasm. It's actual muscle spasm. Okay. The incubation period after you've had an inoculation, I guess you could say, an inoculation of those spores, would be up to 14 days. So that's the reason why, let's say you do get a deep, dirty puncture wound and you go to the emergency room, you can say to the doctor in the emergency room, I'm not sure when my most recent tetanus shot is. I'm going to call my family doctor or check my records when I get home. Because it's the incubation period for this spore to even germinate can be up to 2 weeks. So you don't have to have a tetanus shot right that minute. Okay, you can take a little bit of time and figure out what your records are, because you don't want to over-vaccinate for tetanus, and we're going to talk about that in just a minute. What actually happens then is if the spore gets into your body, the spore then germinates into the bacteria releases the toxin. It's the toxin then that binds to the nerve endings out in your periphery, out at the end of where the nerves attach into the muscles, bind to that and doesn't allow the muscle to relax. It causes it to be like constantly in a spasm. And so that's what tetanus is. How the vaccine works is that it's an antibody that binds up to that toxin and prevents the toxin from adhering to the nerve plate ending so that you don't get the spasm. So you understand the disease process, how that works. Diagnosis is entirely clinical. There's no blood test for tetanus, there's no x-ray, there's no anything like that. It's based on high index of suspicion, and it's a completely clinical diagnosis, and recovery can take several weeks to several months. Now, the first time I read that, when I was going through and reading this stuff about tetanus, when I ran across that sentence, I went, recovery can take 6 weeks to months. My brain went, arr! Went back and I read it again. I mean, I read it like 3 or 4 times because, here I am. I'm a board-certified emergency medicine physician. I've probably given out more tetanus shots than you can shake a stick at. I never really thought about tetanus having full recovery. I always sort of thought that once you got tetanus, it was a uniformly fatal disease. And that's one of the reasons why we over-vaccinate for it and want to make sure that nobody ever gets tetanus, because if you get tetanus, the likelihood of you dying from it, the probability of you dying from it is very high. I don't know where I got that number or got that idea, but somewhere in my training, I always sort of thought that that was the main reason you didn't want to get tetanus. Not that it's not a bad disease, not that, it's not serious, but that I thought it was pretty uniformly fatal. And most of the time when I talk to people about that, that's kind of the general concept, that people think, well, you know, tetanus, if I get tetanus, I could die from it. Well, what is the incidence of it really? This review paper from this MMWR paper that came out in 1998, it was deaths among persons with reported tetanus, vaccination by status in this 2-year period of time. So between 1995 and 1997, there were 124 cases of tetanus that were reported. 66, almost half of them in these reports, they didn't know how many tetanus shots they had. And it would be kind of a safe assumption, if you were doing just an evaluation of the study, to think that some of these people had at least one. I mean, I think that's a fairly safe assumption because most people have at least one somewhere in their life. So of these unknown status, there were 9 deaths. And down here, more than 4 doses, they still had 12 people that got tetanus. I thought that was kind of amazing. That out of this 124 people, 16 patients, 13% of that population were fully vaccinated and they got tetanus anyways. Now, I just thought that was pretty amazing the first time I read that. The other thing I found amazing was that the death rate in this particular population was 11%. Now, that's not insignificant, and I'm not downplaying that, but I am saying that's a far cry from 100%. That's a 89% survival rate of the people that had tetanus. And the other thing that you don't know about these people over here that had the deaths was what was happening to them of why they got tetanus in the first place. Did they have a major crush injury of some farm accident? They got run over by a tractor, or a loaded hay wagon fell over on them or something like that? Because I had a patient like that I saw that once when I was in the ER. Did they, and so were they more likely to get the tetanus infection because they were out in some dirty place and they had some other major, massive thing going on, and so they were weaker? I mean, that's the thing when you look at death rate statistics, you don't really know what the underlying thing was. You don't know if maybe they were out on the ranch somewhere, out in Wyoming somewhere, and they were miles and miles and miles from medical care, and by the time they started having any symptoms, they had full-blown tetanus before they even got into the care. I mean, you don't know. I mean, we could come up with a bunch of what-if scenarios. The point of all of this is that that I found pretty amazing as a board-certified ER doc when I started looking at this was, number one, how many people still got tetanus with all of those vaccines on board, and number two, that the death rate wasn't even anywhere close to 100%, which is what I all those years had perceived it to be. So the first time I read this paper, and I've read several other papers that have been similar to this, it was kind of like, I felt like my brain went kind of stretched out to the side a little bit, and I thought, wow, I guess that takes the fear factor down a lot about tetanus. Now, it doesn't mean that you want to get tetanus, and it's not that it's a benign disease, and it can potentially be fatal, but it's certainly not 100%. And I can tell you how many patients that I've seen over the years when I was still working in the ER that would cut their finger while washing dishes, and they would go sit in the ER for 6 hours on a busy Saturday afternoon and sit there for 6 hours waiting for their tetanus shot, because that's how indoctrinated we are about this. So this is sort of like, this information is to say, yes, this is serious, there's some things else that you can do, but it certainly doesn't, it should take the whole essence of panic out about it. It's the point I wanted to present this material. And there's 2 different types of tetanus vaccines, like there's 2 different types of diphtheria. One is tetanus toxoid. This is the one that's most prevalently given. Like if you go to the doctor's office now and they go, oh, you haven't had a tetanus shot in 10 years, this is the one they would give you. And what this does is it takes the toxoid from the bacteria that was grown in beef broth, and as it grew, it went from a spore into the bacteria. As it did the bacteria, it released the toxin. They take that toxin, and they treat it with formaldehyde, and that inactivates it. So it's not an active, it's gone from a toxin to a toxoid. That's why they say tetanus toxoid. It's inactivated by the formaldehyde. And then they add thimerosal for a preservative. It's the toxoid that they inject into you that develops the antibody, so that if the toxin or from the bacteria is ever available, if you ever get a dirty wound and that bacteria sprouts and releases the toxin, that if that ever happens, then that bacteria or that antibody is around to neutralize that toxin. And that's the whole premise. And it goes back to that whole antibody level and that whole molecular mimicry thing that we talked about earlier. It's like you just got all these antibodies floating around in there with nothing to do. and on the outside case that maybe something might happen someday. Well, this is the other vaccine. It's tetanus immune globulin. And what that is that they have taken the toxoid, this one, and they've injected it into volunteers who then have grown the antibody. And I think they might not even use people for this anymore. I think that they might use like guinea pigs or rabbits or something like that. If they grow the antibody, they inject the toxoid, you get the antibody, and then you siphon that off, and that's what the immune globulin is. So that's the actual antibody already grown. It's what you need. So that if you got this is plasma of donors who've been vaccinated with tetanus toxoid, so I guess maybe they do use plasma of donors. I do think they might use animals for that too, but I'm not 100% sure. So what ends up happening then is if you have one of those dirty crush injuries that happened out on the farm, and you are at a high possibility of being exposed to those spores, you can get the antibody injected right then. It's right there. It's like you don't have to wait for your own body to produce the antibody. It's like a dose of antibody. And that antibody can reach peak levels for 2 days, and it can last up to 3 weeks. So if you have a high-risk exposure at that point in time to get the tetanus immune globulin, it could be protective for you. Now, is it 100% protective? Probably not. But you know what? Neither is a tetanus shot. So, it's sort of like that's sort of like the other side. So this is something that is available for you or for your kids if there is some reason that you think that they need to be protected from tetanus. Adverse reactions. Well, tetanus shots can cause local pain. They can cause abscesses. They can cause, this was just a partial lift. It just came off the package insert. Arthralgias, serum sickness, headache, nausea, vomiting, cardiac arrhythmias, syncope, fainting. There was a case report of a teenager who got a tetanus shot in the doctor's office, walked out, passed out, hit their head, ended up with a subdural hematoma, ended up in the hospital for having a surgery to evacuate the subdural hematoma, and had like long-term disability from that. It was a case report. And so, so it's not, and then it's sort of like, well, what was the cost of that? Because all these vaccines now are looked at in terms of a cost-benefit ratio. So these things do happen. That was a case report, okay? And case reports are legitimate things. And when we get to talking about the MMR, we'll talk a little bit more about case reports. But doctors write up case reports all the time to bring things to people's attention. A variety of neurological complications, including seizures and encephalopathy. And I want you to remember that word, because encephalopathy means like inflammation of the brain. It's the same word that we'll use when we talk about pertussis, and you give tetanus and pertussis together. And all the focus has been on pertussis, but we kind of forget that tetanus isn't a benign vaccine either. And it can cause these things, including seizures and encephalopathy, anaphylaxis and Guillain-Barré syndrome. Guillain-Barré is a progressive paralysis that people can be on ventilators for months. Okay? And this just came right out of the package insert. These were reports of that. It wasn't in any bizarre sort of place. So, and people who experience severe reactions most likely have high serum tetanus antibody levels due to excessive vaccination. So the whole concept of, well, gee, have you had a tetanus shot in 10 years? If not, well, we'll just give you one. We don't, without knowing what an antibody level is, I mean, here's 2 references for that. Severe tetanus in immunized patients with high anti-tetanus titers, and this was the one that was talking about problems with excessive vaccination. So much for the concept, and I mean, I admit, this was part of my concept when I was an ER doc, was, well, little is good, a little bit more won't hurt them, and if we're not sure whether or not they had one in the last couple of years, just go ahead and give it to them. It's not going to matter. It's sort of a benign thing. And that's kind of what you think about. It's just, you just think that the only thing that's in there is a little tetanus toxoid and a little saline. You don't think there's anything else there that can hurt anybody, and so a little bit isn't going to matter. And I know that I admit that that was part of my thinking. I would have to wager to say that that's probably the thinking of a good portion of doctors. I don't want to say all, but a good portion of people is like, well, what's it going to hurt? Well, here's a couple of things that says that excess vaccination is most likely to induce people to have severe reactions. So what do you do about wounds? I mean, what do you do if you decide that you don't want to, you as an adult don't want to be vaccinated, or you don't want to give your kids vaccines for tetanus? Well, you can, if you get a really dirty, awful, crummy wound, you can use, there's antibiotics that you can use. You can use metronidazole, which is Flagyl, which is for anaerobic infections, or you can use injectable penicillin. And actually, this red book, from the report of the Committee of Infectious Diseases of the American Academy of Pediatrics, they actually say in there all dirty wounds should be treated with antibiotics. You know, if it's an antibiotic that's going to kill off that bacteria, then that's what you should do. The other thing is you can consider using that tetanus immune globulin like we talked about before. Okay. So keep some things in mind about tetanus. Tetanus is not a uniformly fatal disease. It's a serious disease. It's a serious infection. You don't want to get it, but it's not uniformly fatal. Tetanus vaccination is not benign. It causes problems and causes potential for encephalopathy in babies, and it can cause cardiac arrhythmias, fainting, all sorts of things in adults. Clinical tetanus is possible even if fully vaccinated. So we kind of get with this tetanus vaccine sort of this false sense of security that we think that, like we do with most of the other vaccines. We think that if we've got this vaccine, it's going to protect us, and that's not necessarily true. And that treatments are available for potential infection. We've talked about the antibiotic, and we talked about the tetanus immune globulin. The other thing is that there's absolutely no universally protective level of antibodies. So even if you get a shot, how much do you need? Nobody really knows. And the level of antibody currently considered to be protective is 0.01 antitoxin units per ml. It's based on animal studies that were done in 1937. So we think that that's going to protect us, but we're not really sure. So it's one of these dogmas that have gotten perpetuated for a lot of years. If you get a tetanus shot, it's going to protect you. How much antibody do I need? Well, we don't really know, and even if you have that amount, you can still get the disease anyways. So what are you going to do? I mean, here's some options for you. Profound wound cleaning is the most important tool. We've known that. It's been published in the medical literature since the 1940s. How do you prevent getting tetanus? You wash it out. The other thing that you do is every wound should be allowed to bleed freely. I mean, the first thing that we do is we want to like put pressure on it and stop it from bleeding, right? You know, that's not what we all do with all of it. I mean, I grew up on a farm. And my dad was a chiropractor, but we grew up on a farm and we raised horses. We raised standardbred race horses, as was one of my dad's hobbies. So we'd be over in the barn and my dad would get a cut or something. And I remember this to this day. He'd run over in the kitchen, he'd turn on the kitchen faucet, and he'd be squeezing his finger. He'd go, make it bleed, make it bleed, make it bleed. And he'd just like keep it open and want it to bleed and bleed and bleed and bleed for like 10, 15 minutes. Well, he was doing the right thing, because that's what you want to do. And what is the first thing that we do is we grab a something and we put pressure on it and make it stop bleeding. So, and then that clot starts to form normal physiological stuff, and we trap any potential dirty bacteria that might be in there. So what you want to do is if your kids get cut, make it bleed. Make them bleed, okay? The other thing is apply hydrogen peroxide to the wound. It's cheap, easy, and it works. Now, why does hydrogen peroxide work for tetanus? Because what hydrogen peroxide delivers to the wound is oxygen. The bacteria that causes tetanus can't live in the presence of oxygen. So you really want to put the peroxide in there. You really do. Peroxide is a product that should be in all of your households, and to remain potent, the bottle should be replaced every year. Okay? So if you've got one that's you've been sitting in there for a long time, it's probably lost a lot of its bubble power. I mean, what is it? A few pennies, 69 cents or something to get a bottle. Just go get a new one. The homeopathic remedies, ledum and hypericium, that when administered, if the wound looks sort of suspicious, these have had a track record in homeopathy fields to kind of build up the body's resistance to the tetanus. And those are some things that you can keep in your medicine cabinet. You can just get that at the health food store. Okay, and consider if it's really bad, I mean, if it's a serious crush injury, you know, a farm accident, I mean, something that's really dirty, you know, dirt bike, you know, that you're all scraped up and you can't really clean it out. Use antibiotics to try to kill the bacteria that would release the toxin to cause the problem. And if it's really bad, you may want to consider to use the tetanus immune globulin, which delivers the antibody right then. Okay? So does that give you sort of some things to sort of think about? Takes down the fear factor about the infection. Know that you've got some time to deal with it. Know that you've got some things in your toolbox in your hands that you can do, so you don't feel powerless about that. Now, what about the pertussis? We've done diphtheria, we've done tetanus, now we're going to do pertussis. Now, pertussis, the common name for that is whooping cough. And it's caused, again, like with tetanus. It's the bacteria, that's Bordetella pertussis and Bordetella parapertussis, that infection then releases toxins, lots of different toxins, and it's the toxins that actually cause the problem. The most prominent feature of whooping cough is that paroxysmal coughing, and the kids cough until they vomit, and that's pretty characteristic of it. Newborns may not have that cough reflex, and they may present as like not breathing and sort of turning blue instead of the cough. Patients are usually afebrile. They don't have a fever. If they have a fever, it's probably not pertussis. It's probably some other type of infection. And I think that's important. Okay. Now, complications of an infection. Okay, if you get pertussis, about 16% will go on to develop pneumonia. Some will get sinus, and some will get otitis. Now, I want you to pay attention to this, that seizures, encephalopathy, and death, 0.02%, it's very small, but it does happen, it's a real risk, is a complication of the infection. Keep that in mind. Seizures, encephalopathy, and death are a complication of the potential of the infection. Now, pediatricians and doctors will scare you to death about pertussis, and they will say it's the most serious disease in kids under the age of 2 months, which is true. There's no doubt about it. It is a serious disease. And what gets propagated sometimes is if your kid gets pertussis, they will die. That's really not true. And let's put some of these pertussis risks, the risk of death in perspective, okay? That in a 15-year period of time, there were 92 deaths to pertussis. That's about 6 per year. Now, that's a real risk, absolutely. But the risk is small. And let's just compare it to a couple of other things that can happen to kids. In 1997 alone, 112 kids died from falls, and 18 of them died from falling out of windows. That's in 1 year. Okay? And in 1999 alone, 53 kids died while drowning just in the state of Georgia, and 4 drowned in a bathtub at home. So about the same number drowned in their bathtubs as died of pertussis. So is that a real risk? Yeah. And I'll say this sort of tongue-in-cheek, do we want to what are we going to do about this bathtub thing, I mean, that's just as scary. I probably shouldn't have said that. But sometimes you just have to keep things a little bit light on this information, because 6 deaths per year is real, but how real is it in terms of 77,000 live births per week and 4 million kids per year that are born? If you stand back and look at those numbers, it's not quite as scary. I mean, your kid could run over by a car running out chasing a ball in your front yard, too. I mean, when you get to be a parent, when you decide to be a parent, you sign up for some risks. You just do. So what's important as a parent is to evaluate how real is the risk and how much structure do you have to put around that to keep those kids safe. The vaccine deaths versus deaths from whooping cough. In 1998, the number of infants that died from the day after vaccination was 23. In 2000, the number of kids that died from whooping cough was 17. Wow, look at that. And this came from a CDC document. So more kids died in 1 year, the day after vaccination, than they died from whooping cough. Okay, and here's another one of those statistical things. Remember I told you that all these charts come from the Bureau of Vital Statistics, and this is mortality rates. This is where pertussis was down here when we started using the vaccine. So all of the big things that get talked about in terms of pertussis, yes, unequivocally it's a serious disease. How serious is it? Well, the younger the child, the more risk that it is. But as they get a little bit older, because their airway gets larger so they can handle those secretions and the coughing and things like that, the risk starts to go down. And then the real risk in terms of an epidemiological risk is really pretty low. So that should take down some of the angst a little bit about the fear of the disease. No, you don't want to get it, but how scary is it? Okay? Because the side effects of the pertussis vaccine are like this. Remember what we talked about in terms of what happens if you get the disease? Well, the side effects of the vaccine can be seizures, death, and encephalopathy. And what's encephalopathy? Irritable, persistent, unusual, that high-pitched screaming that they talk about, and the hypersomnolence. They just sleep and sleep and sleep and sleep and sleep for days because they're almost like their whole brain is inflamed. And remember we talked about encephalopathy. It can also occur as a side effect of tetanus vaccine, and we give tetanus and pertussis together. A lot of potential for problems there. And the relative risk of previously normal infant developing permanent encephalopathy was 4.2 times greater during the first 72 hours following DTP vaccination than in controls, and the risk of permanent brain damage was calculated to be about 1 in 300,000 doses. Now, that's per dose. And note that if each child actually received the recommended doses, 2, 4, and 6 months, and 2 booster doses, the potential for permanent brain damage could be as high as 1 in 60,000. Now I want to make a note here. This statistic and this information came from whole cell pertussis, not acellular, and we're going to talk about the difference in just a minute. But whole cell pertussis was used almost exclusively in this country before the year 2001. Okay, so if it was through the 80s, through the 70s, 80s, and 90s, it absolutely, you're almost guaranteed that the vaccine that was given was whole cell. That's not today, and we're going to talk about that in just a minute. But so if you've got older children or things like that, this could basically have applied to them. And what about the difference between whole cell and acellular? What is the real big difference? Well, the severe symptoms of pertussis, of the infection, are caused by the release of that toxin from the bacteria. Now, the bacteria gets infected, and then it releases these toxins, and the toxins that are released are neurotoxins. So what the vaccine is supposed to do is they take the toxin, the whole cell pertussis that was manufactured in 1933, is they took the bacteria, they grew the bacteria, they took the toxin, and they directly injected the toxin without inactivating it into the babies to develop the antibody to the toxin in the event that they get infected with pertussis and the pertussis bacteria releases the toxin. Do you follow that? Okay. So the first vaccine was manufactured in 1933. Keep that in mind. And virtually every year from 1933 through the mid-1980s, a paper was published discussing the adverse effects of whole cell pertussis vaccine. And the first acellular pertussis vaccine was available in 1937. And what they did with that was they removed most of the other proteins that were involved with the whole cell pertussis, and they also took the toxin and they inactivated it with formaldehyde, like what we did with the tetanus toxin. You know, we took the tetanus toxin and activated it with formaldehyde and made it a toxoid. Well, they took the pertussis toxin and activated it with formaldehyde and made it into a toxoid. You follow that? Now, the important part of that is that weaker vaccine, safer vaccine, less toxic vaccine started to become available in 1937. Well, in 1978, the public started having a lot of problems, and they started realizing, they started reading all the literature that had been produced all those years from back here from 1933 to the mid-1980s of all these problems with the whole cell pertussis vaccine. And so the Institute of Medicine started holding these committee meetings. In 85, they discussed it. In 90, they discussed it. In 93, they said, yes, whole cell pertussis vaccine can cause permanent brain damage. In 94, they said it was more likely than not that they were responsible for encephalitis up to 7 days in previously normal children. So there's a lot of all this discussion that was going on, and it wasn't until 2001 that even though a safer vaccine, this acellular pertussis vaccine, had been available since 1937, whole cell pertussis was finally removed from the U.S. market 64 years later. Somehow that should be criminal. That we've been using this, and even though whole cell was available and acellular was available, and some kids got one and some kids got another, when you also read about the manufacturer about the pertussis vaccine, there's not a lot of standardization between the different manufacturers. So if you have a acellular pertussis vaccine from, say, Wyeth and one that's from Aventis, they are manufactured differently, so you can't really even compare the safety things between the two of them. So this has been, and they still use whole cell in all the third world countries. It's cheaper to make. The reason that I've spent the extra time talking about this is this, that as many as 1 in 60,000 previously normal children may have suffered from permanent brain damage from whole cell. And that very real possibility exists that the whole cell pertussis vaccine may be caused milder brain damage in a very high percentage of children, including loss of IQ points, reading problems, language difficulties, even autism. And that since mild brain damage may not show up for years after vaccination, we may never really know the full extent of what was happening during that whole cell pertussis thing. And that entire section, those last 4 or 5 slides that I just had up there, was taken from this paper, The True Story of Pertussis Vaccination or a Sordid Legacy by Dr. David and Mark Geyer. And the Journal of History of Medicine and Allied Sciences published that in 2002. So it's a relatively recent review. I mean, it hasn't been around for a long time. And another reason that I spent some extra time talking about this was that if you think that your child may have had whole cell pertussis vaccine, during those periods of time, and if you think that they have any of these types of problems, you may want to consider filing a VAERS report. You may want to consider, you may even want to consider talking about some of the vaccine injury compensation program if it's a severe sort of injury, because the data exists, it's been around for a long time, and there are attorneys and there are firms that are looking into these things. So that really exists. And I think that it's something that that all parents need to know about, particularly parents with older children. Now, since 2001, acellular is the one that's been used, and I do believe that acellular was available before that. But unless your pediatrician was specifically using it, or you were specifically looking for it using the acellular, you may not know whether or not whole cell was used. Okay? The other thing that I think is quite the travesty, given the fact that this is a 64-year history about this vaccine, is that I was in a meeting in Washington, D.C. in March of 2004 at the first International Neonatal Vaccination Conference, because now they're talking about vaccinating more and more and more in newborns. And they're talking about returning to the use of whole cell pertussis in newborns, because whole cell pertussis has a higher level of antibodies that are produced in newborns than acellular. So they've been doing these looking at using whole cell in babies, newborns. And I just think we're just causing more and more problems with that. So why this delay in this transition? 64 years is a long time to be talking about this. All the way through the 80s and 90s we talked about it. Well, it's that whole thing we talked about a little bit earlier. The temporal association does not prove causality. I mean, if two things are happening at the same time, does one actually cause the other? Well, the very first time that I read this, when I started looking at that association, that temporal association does not prove causality, I thought, doctors have that in their brain. How do we get that in our brains? I mean, I can remember, being in the ER doc, and I would see parents come charging in there after they, maybe 3 or 4 hours before they'd had their baby at the family doctor or the pediatrician's office, and they bring them in and they're actively seizing. And I can remember parents saying things, looking at me and saying, I just at the pediatrician's office and they got vaccines this morning. Do you think the vaccines had anything to do with it? And I would say, well, no, I don't think so. And I distinctly remember walking away and walking back and over to writing on the chart and thinking, gosh, if vaccines caused it, there must have been something wrong with that kid that they couldn't handle having those vaccines. Now, where would I have gotten that thought? Well, the first time I saw that in writing, I cried, because it actually is in writing. It says there's no distinct syndrome from vaccine administration, and therefore many temporally associated adverse events probably represent background illness rather than illness caused by the vaccine. The DTaP may stimulate or precipitate inevitable symptoms of underlying CNS disorders such as seizures, infantile spasms, epilepsy, or SIDS. By chance alone, some of these cases will seem to be temporally related to the DTaP. It's like, so your child was going to die, was going to have SIDS, and it was going to happen anyway, and just because we gave it the DTP that we uncovered that? I remember where I was when I first read this. This came from the CDC book, Epidemiology and Prevention, this pink book. I remember sitting at my computer. In my house, I have a great big table. It's a dining room table that's actually my computer table, and this is the front of my house, and there's a window here. And I remember it was late at night, and I remember just crying. I mean, I just literally just looked out the window and just cried and said, God, they've indoctrinated us to believe that from somewhere, that if something happens because of a vaccine, it's not the vaccine. There is something defective about that child. It still breaks my heart to think about it, because we really did somewhere, even if it was at some subliminal message, we got that as doctors. And when I saw it actually in writing, I just was really amazed. It really kind of broke my heart. Because we need to stop deceiving people that vaccines are the most effective protection and start developing new therapeutic preventive approaches. And this is from a doctor that's from Russia who says it was head of their biological weapons program. And I just think that quote's very true, and it very much applies to all of us.